Section here, I wanted to talk a bit about SLAW's other programs, as well as mention the 2017 and the 2018 PAFs, and what exactly the annual report is. So for that, um, we'll start with the PAF goals from 2017 and 2018. Um, the phase goals in phase 6 here were much the same as what was mentioned in previous phases, but they've also wanted to collaborate with the Thai Ministry of Health and other local clinics to bring the patients from these rural COPROC communities to clinics to be seen. Transportation is a little bit difficult in this area, and so bringing either the mobile medical team to these communities or bringing the patients from these communities to a clinic would be two ways to address that barrier of transportation. Um, Also expanding different topics, again, to cover areas of reproductive health, pregnancies, abortions. There's also goals of increasing and expanding the number of peer educators, also within communities in Mason, and doing that by increasing the number of target communities. Um, in phase 7, again, expanding on what has been covered in previous phases, providing access to birth control condoms within those communities, and then also personal hygiene products awareness to the migrant schools. And this has been an initiative that has been repeated through the different phases of CHOP. So next, I wanted to talk a bit about the annual reports. Annual reports are a project that the GROW intern team completes over the summer. They write a report that details SLAW's programs, not just the CHOP program, the one that Globin and UC and SLAW are partnered for, but all of SLAW's different programs. And it really gives a good look into the different things and different areas in which SLAW is involved in. On the left, you can see the cover photo from the 2017 annual report, and then the two pictures on the right are from the 2018 annual report. I myself had a hand in writing the 2018 report because I was an intern during the GROW 2019 trip. So I've included a lot of different screenshots here, and I like to talk about it, but we could probably talk about the annual report in a whole other meeting, so I'll be kind of brief with what I choose to touch on. First, a section about CHOP, which is, again, UC's, Globin at UC's and SLAW's partner project. This is the Community Health Outreach Program, and in 2018, you can see 22 different communities were reached with 250 total workshop attendees. There were 25 peer educators trained in 2018, and here on the right, we have a highlight, like a little interview profile of 2 of those peer educators that we were able to meet during the workshops we attended on the GROW trip. Another page from that 2018 annual report is discussing the mobile medical team. Weston did such a great job in describing some of the purposes of the mobile medical team. We just had to include a page in the annual report describing the fact that it's been discontinued. The doctor here, you might have recognized him from the old picture. His name is Dr. Tinsaw. He was a real legend among SAW and the COPROC community for being a doctor who traveled with the mobile medical team. Unfortunately, he retired, and since his retirement, there hasn't been anybody who can step up to meet that need. Also, since SAW is now a legal foundation, a legal organization in Thailand, they need to comply by Thai regulations and rules, and that requires hiring a Thai doctor in order to service this community. That alone is a barrier in terms of hiring and paying the salary for a Thai doctor. Also, the language barrier between a Thai doctor working with Burmese migrants and the need for an interpreter. So for a multitude of reasons, the mobile medical team had to be discontinued. Another program that was discontinued was the gender-based violence programs and projects that SLAW operated. This page on the left is from the 2017 report describing the Green Hope Center, which used to be a shelter for women and children escaping from domestic violence. It was such an important shelter that unfortunately had to be closed at the end of 2018 due to budget cuts. That was something we discovered on the GROW 2019 trip. Also, the GBV coordinator foresaw she left. She was found a better job in Burma that paid more and she could support her family. So for those reasons, the coordinator left, and since then they haven't been able to hold family talk workshops or gender-based violence workshops, which again promote these ideas of what is domestic violence, what to look out for among communities and Burmese migrant communities living in Pokhara. Okay, moving on to a few programs and shelters that SAW does operate, and I'll try and be brief. We have the Healthcare House, which is a center in Mesot for HIV women or women and children living with HIV/AIDS. They also are able to receive antiretroviral treatments thanks to transportation that SAW arranges between Healthcare House and their other hospitals. And then on the three here, we have three shelters to mention: Safe House, the Boarding House, and the Children's Crisis Center. All three of these shelters have been relocated to SAW's main compound. You can see a picture of that in the top right. These are all the shelters that house children, whether they're orphaned Thai children of Burmese descent, or whether they're Burmese migrant children attending SAW's Migrant Learning Center. Or for whatever reason, the student or child is there. These are one of SAW's shelters that supports their needs. A few slides, again, we take a look at SAW's overall budget. In the year 2018, it was something over 8 million baht. Off the top of my head, I can't do the conversion to dollars, but dividing that number by 30 would tell you how many dollars the yearly budget SAW had. And this again is a document that the Grow interns have created for SAW so that they can show with their donors who come, or any of their funders who want to know more about all their other programs. They're able to show them this document and show off all the impact that they've made. All right, deep breath in. I now just want to debrief, and I know I threw a lot of information at you all, but generally, what are your impressions? What is the role of the annual report? And then based on what you saw in those annual reports, what areas does SAW work in and operate to support migrants in Thailand? So Brooke asks a question in the chat: is it sort of like an impact report? I think you can definitely think of it as an impact report. Some collection of the data that SAW has collected for that year, of what have our programs done in that year, who did they reach, how many people did they reach, and also discussing how much it took to fund and to operate those programs so that donors get a bigger picture of both sides of the equation, the health, and they can assess the health of our organization and of SAW as well. Jonathan adds, an annual report is an important tool for NGOs when applying for grants and funding. Yes, that's another big reason why we want to write an annual report. And part of that is Grow interns able to leverage their skills as college students, like whether you've had design experience or not, just even proficiency with the English language and putting these promotional ideas, these reports and data that you find into a presentable document is huge for an organization like SAW. So yes, Maria again uplifting that English bit, and we'll talk a little bit later about what we can do to uplift and to amplify SAW's English capabilities. So I see a question here from Emma. Is the role of the annual report also to understand where the community is at and see what areas need help and what has been accomplished? I think that's a goal for an annual report in the future. I think that would be very useful to include. I say that because as of now, we probably can understand where the community is at based on secondhand accounts or like the secondary sources, mainly ATL. If we asked him a question, he could tell us what he knows about where the community is at. But because we haven't been on the ground, we haven't been able to like do data collection or to really assess where a community might be. at and include that data in our annual report. But if you want to read the 2018 annual report, you'll probably see that it's filled with stories of anecdotes of personal experiences that we've heard and are wanting to share with donors. So I think that's a way of representing what areas need help and in what areas SAW is focusing on. And especially the what has been accomplished. We want to celebrate SAW's accomplishments. Okay. Well, thanks for all your contributions to the chat there, engaging in that conversation. We're on to our final section.
Okay.